Hi and welcome back to the podcast. I am happy today to have a guest on my podcast. Her name is Christine Horton. She is a seasoned dental hygienist with over 20 years of experience. She's originally from our country of Canada, but she is now based in Texas. And she is a mother of four. So she balances her passion for helping others with her deep commitment to education and promoting oral systemic, that is, mouth body health. She specializes in coaching women with polycystic ovarian disease and metabolic syndrome. And she's always striving to bridge the gap between dental health and overall wellness. And that's why I have her on today, because I love this idea of dental health and overall wellness. So I'm excited to have Christine here today. So welcome to the podcast, Christine.
Thank you. I'm excited to be here.
Yeah, I love how you're using dental health because it isn't something we think of when we think of our overall health. We don't necessarily think of our dental health, which is really not, doesn't make a lot of sense, but we kind of think of them separately. So before we dive into that aspect, I just want to understand you and your background and why you're now doing the work you're doing.
Sure. Yeah, absolutely. So I have been a hygienist for a long time and I had a family. And so I balanced those two things. And I've had my own health issues and have looked for answers for myself. And it kind of led me down this road of oral systemic health, which has been around for a while, but we're just hearing more and more about it. And so once I started finding out some things that were beneficial to me, I wanted to find out more. And then I realized I could help my clients more. And I was ready for a change in my life. My youngest child is at college in August. And so we were prepping for that time to come when she was going to leave. And it just felt like a great time that I could start my own business where I could help people one on one to really dive into what they're dealing with and find answers for them because it is so personalized. There's no one size fits all, especially when you're talking metabolic issues and polycystic ovarian disease. But even things like prediabetes or heart disease, losing weight, there's just not one perfect thing. So I took my certification in the last year for health coaching, and I'm working currently on my oral systemic educator certificate, and that should be done soon. And I'm just really interested in helping women live their best, healthiest life.
I love that because it's such a different angle, the oral systemic health, which is honestly not a term I've heard before, and I guess I'm not alone. I'm sure
Yeah,
it's not something everybody's aware of. And
absolutely.
yeah, so I guess you come up against that a lot in your work, right? This is something, like you said, it's something that we haven't talked about in the past, but it does, our oral health affects our entire body health, I guess is how a very simplistic way of maybe saying it.
Absolutely. So the way I like to describe it is it's that connection between our body and our mouth. And a good way to look at it is kind of the mouth is the window into the body. So if we see disease in the body, we're often going to see some symptoms in the mouth, and vice versa. If we see things in the mouth, often we're going to see things in the body. So if we're trying to get to true wellness, if we look at both aspects, we're going to get better results than if we look at just healing the body or just healing the mouth. And that's really where the fusion part of my health coaching comes in, is we want to fuse that medical world and that dental world together so we can get the best results for our clients.
Yeah, I think that's so important because, yeah, they just seem so separate that
Mhm.
you don't think of them as together, but that they can inform each other is new. Like to me, that's new. So I love that idea. And I'm wondering specifically because this podcast is for women in midlife, we do have certain issues that do show up in midlife. Are there things like about our oral health that we should be aware of at this time of our life?
Yeah, absolutely. There's a couple of different things. One is always hormone changes, right? Premenopause, menopausal women, there's always that shift in hormones. And so sometimes there are things that show up in the mouth or in the body. And so you really want to have that monitored. And, sometimes what you've been doing for the last 5 years, 10 years, 20 years, whatever, all of a sudden isn't working like it had previously because the hormones have changed how the body's reacting to. It could be plaque, it could be all kinds of things. So, definitely things you want to monitor, definitely specific for women who do have that hormonal shift. The other thing is in midlife, we tend to be at a higher risk. Our immune system maybe isn't working like it did when we were 20 years old. So, just our overall risk for chronic conditions like heart disease or diabetes, they just become more prevalent. So, we really want to make sure everything is a-okay as we reach those fun years where we can focus a little more on ourselves, hopefully, right?
Yeah, well, I think that's what we all want, right? We
Yeah.
all want to go through this time as healthy as possible. So when we think about preventing heart disease, preventing diabetes, what is it about our mouth health that we can where we like if we're going to focus on what we can do about that when it comes to our oral health, what are the things that we can do to help prevent these conditions, like you said, because our immune system is not as great as it was, because our bodies are, like it or not functioning at the highest level anymore? What are some things we can do to help ourselves orally?
Yeah, so I kind of have three things that I've kind of outlined that we really could help ourselves with. And so the first thing is just try educating ourselves about that mouth body connection. It is coming up in the news all over, how your oral health affects your heart health, how your oral health can affect your diabetes, possibility, potential, all those kinds of things. So really get some knowledge in that area so that we can see how that's a bi-directional. If we can make improvements in our mouth, often we can see improvements in our whole body, and vice versa. If we can make improvements in our body, we can see that in the mouth. So that's the first thing I would say is let's just try understanding the connection. So we know that they're connected and we no longer think of them as two separate entities. The second thing that I would say is you want to create a team of professionals that you can communicate with and that you trust and that you can have real conversations. I think gone are the days where we just go to a dentist or a doctor or a medical or dental professional and you tell them whatever and they just give you the information and there's no conversation about it, right? We are all about educating ourselves and making the best choices for ourselves. So I just really encourage everybody to find professionals that you can work with so you can be the best version of yourself. And sometimes that means changes, and other times you already have that team in place, and both are great, but it's just super important to have that in place and know that prevention is your best bet. If we can stop problems before they start, or when they're very small, it's way easier to treat. It's way less expensive. It's way less invasive. So what they're recommending for how often you see for your screenings, for your dental visits, for your annual checkups, you want to be on top of that so we can catch things sooner rather than later. And along with that, you want to know your numbers. So we have different numbers that kind of are a guide for our overall health as well as our dental health. And so numbers that you'd want to pay attention to are, what is my blood pressure? What is my fasting blood sugar level or my A1C level? And then on the dental side, you want to know your periodontal status. So you want to know what your probing numbers are and if there's bleeding and if there's bone loss. Those are kind of the three big things from the dental world. And then finally, our cholesterol levels, another kind of quick check of our overall health. So I feel by, working with your team of medical and dental and looking at those numbers, you can really get a good look at what your personal health is overview. And then the third thing that I would highly suggest is you want to disrupt all the bacteria in your mouth before you go to bed. So whatever your oral hygiene program is on a daily basis. Just make sure you're doing things before you go to bed. And the reason for that is when you're sleeping, it is warm, dark, and nothing moves for as long as you're asleep. So that is like the perfect, perfect environment for bacteria. And so we want to make sure that we have our bacterial levels low and hopefully the healthy ones in there, um, so that they can't do any damage to the teeth, the gums, the body while we're sleeping and recuperating from our day.
Yeah. Okay. Okay. I like that. And that makes sense. I mean, a lot of us do, we brush our teeth before bed, but I assume it goes, what are the other things we should do before bed besides brush and floss? Is there anything else that we could do to disrupt the bacteria?
Yeah, those are really good starting points. Interdental cleaning, the big thing right now is kind of the water pick, which some people are familiar with. And I
Mm.
kind of explain it. It's messy when you first start with it, but it is kind of like a pressure washer for your gums and teeth. It just kind of blasts everything out. So I have a lot of clients that really like using that and their teeth feel really clean. And then some people like to use a mouthwash of some sort. And if you're going to do that, you'd want to advise with your dental professional what's the best choice for you. There's different ones for different things depending on your personal circumstance.
Okay. So when you talk about the water pick, is that something you would do every day? Or is that just like once a week? Like how often would you use
Sure,
that?
you can do it at whatever interval you choose.
Okay.
It's not going to do any harm if you do it every day. Do you absolutely have to do it every day? I don't know. We want to see what your numbers are. We want to see if you
Okay.
have any bleeding. We might recommend it more if you were trying to deal with active disease. If we've arrested or you don't have any disease and you're just trying to control bacteria, maybe it's only a couple of times a week. But those are
Okay.
all things that you'd want to look at and decide with your dental professional.
Okay. So I want to go back to the numbers because I don't
Hmm.
know my numbers. Like I don't
Okay.
know my dental numbers that you mentioned. So you mentioned periodontal status and probing number. So what are these things and will my dentist understand if I ask for this? Because I've
They
never
will.
heard
They'll
these
be like,
numbers.
who have you been talking to? That's what they'll say. Because most people don't know it. I feel like for a lot of people, when they go to the dentist, there's a lot of nervousness or anxiety, and you just want to get in and get out. And I
Yes.
feel that deeply. I like being on the other side rather than in the chair as well. But it's super important. And I feel as dental professionals, we're going to hear more and more conversation about these things. So when I'm talking numbers, what they're doing, and it's usually the hygienist who does it, but a dentist could do it as well, is they're using a little teeny weeny little probe and they are measuring where the tooth meets the gum. And so typically they do 6 measurements on every tooth and they will call out the numbers. Sometimes they have a computer program that will then put it into your periodontal chart. Other times they might have an assistant or another hygienist or somebody come in and they're typing them in as they go. And so in a healthy mouth, we would have 3 millimeters or less with no bleeding. If we have bleeding, that tells us that there's some level of inflammation. The scale is 0 or 1 to 10 millimeters. And
Mm.
so everybody has different numbers on different parts of every tooth, but we want to know what those numbers are. We want to know what the highest number is. And, do we just have one tooth that maybe is a 4 and just on that, border, or are we generalized like we're in the 5s and the 6s and that sort of
Mm.
stuff. So those are the dental numbers we want to know. And so that tells a dental professional, are we dealing with a healthy mouth? Are we dealing with someone who has gingivitis? And gingivitis is reversible and it is inflammation in the gums.
Mm.
There's also periodontitis, and that now affects our bone levels, and bone supports teeth. So it's super important that we keep those bone levels because that's what holds the teeth in. So we need to know all this information for ourselves. Often our dental professionals are doing a great job and they know it and they're monitoring it. But I feel like 20 years ago, if I asked someone their blood pressure, they would have went, I don't know. My doctor said it was good. And so that's what I went with. And now most people would be like, oh, I think it was about this, or let me pull up my app and I can look that up from my last appointment. But I don't think in the dental world we're quite there yet, but I'd love to see us go there so that we do know our numbers and know our periodontal status. Because we know, I was looking up Canada's numbers, and it's about 7 out of 10 have some sort of involvement with inflammation in the mouth. So either they have the gingivitis or periodontitis. And so those are important things to know.
Okay. So gingivitis, from what I understand, is inflammation of the gums,
Correct?
and there could be bleeding associated with that, I guess.
Yes. Often
And
bleeding, yes.
periodontitis is what exactly? Is it when that measurement you were talking about goes beyond 3, or what is it?
Often there's a combined factors, but it tends to affect the bone level around the tooth. So when we take
Okay.
x-rays, and that's why x-rays are very important for many reasons, but that's one of them, is there's an optimal bone level where it was from the beginning. And so we want to monitor that and make sure that it's not being affected. Because if periodontitis is present and not treated, the bone does go away, and eventually the teeth will get loose. And we measure all those
Mhm.
things. We have mobility scales, we have all kinds of things, but that's getting super technical for the
Yeah.
average person. So you really just, when you go to the dentist, you want to talk to your dentist about, do I have cavities? Because cavities are active infection, and we don't want any active infection in our mouth, because it's not just about our mouth, it's going to affect our whole body. And if it's
Mhm.
not treated, you can get systemic infections, and obviously that's not a good thing for our health. And then we also want to talk about, what are those numbers? What is my periodontal status? Am I healthy? Do I have gingivitis? Do I have periodontitis? And if so, what do we do to treat those, right? So we can get
Yeah.
back to healthy.
Yeah, I just before I you said something super important, and
Mhm.
which is what happens when you have a cavity is that yes, the tooth is infected, but it could affect your whole body. Like it can affect your whole body health. And I think that is something we don't think about. And I know we keep coming back to that, but I just want to emphasize that, yeah, it's not just a tooth problem. It's a whole body. It could be a whole body issue if you don't take care of the cavities in your mouth.
Absolutely. And that is true for everyone, including children. There
Mm.
are some children that do not have access to dental care, and they do have cavities. And unfortunately, there is documented cases of children passing away from a cavity that then turned into a systemic infection and ultimately took their life. So it
Wow.
is very serious. It's something you got to deal with, and the best way to deal with it is just not to get a cavity to begin with, which is the ultimate goal. But if you do, get it treated while it's small.
Yeah. Okay. Okay. That's so good. And then, so asking about cavities, asking for our periodontal status. So the bone, like the bone, do we have enough bone mass there? And do we have gingivitis or any, are we heading towards that, I guess?
Correct.
I'm curious too, because obviously as women in midlife, one of the big issues is osteopenia, osteoporosis, meaning we're losing bone mass. Is that reflected in our mouth as well?
It sure can be. And, often we go to the same medical or dental professionals. And so they can see that and track that. And that's one of the nice things about technology, is it's all in a computer now. So we actually have systems that can analyze it and look at it over the years and see if it's the same, if it's different, all of those things. And those are great conversations to have with your dental professional and see what your
Ah.
exact situation is.
I really want to ask that question next time I go to the dentist. I want to find out. Is my bone diminishing? Is this something I should be concerned about? Like, I'm wondering, can the dentist maybe see something before I go for a full body scan? Like, would that show up since I do go for x-rays? I usually have an x-ray at least every year, it seems to me. So I'm wondering if that shows up.
Yeah, absolutely. Ask them and see what type of x-rays they're taking. And often they'll bring you to their screen and show you what they see, and they can bring up previous years and where the bone level is and explain all the things so that you are an informed client, and you know what you're looking at and what's happening in your body, which is ultimately the goal, so you can make the best decision for yourself.
This is so good because I feel more empowered. Not that I'm really looking forward to going to the dentist next time,
I hear
but
you on a very deep level. I want people to know that that is the norm. We have a few awesome kids because we've come so far in dentistry that love going to the dentist, and there's nothing that makes a dental professional happier than that. But there are so many people that have anxiety or fear, and I just want to encourage them that prevention is where it's at. You will spend
Mm,
way less time at your dental
mm.
office if you go in for those regular appointments than putting it off and coming every 5 years, because then we're usually not just dealing with little things, and you got to come back so we can help you get healthy again.
Okay. No, that's good. And it is empowering. Like, as much as, we don't want to know that we have a problem, but it's empowering to know the questions to ask. Like, and you go there with more education, so you understand what you're asking about. And this is why I have you on. It's because I didn't know the questions to ask. I didn't know beyond the cavity what other things I should be concerned about, but you've lined them up here so I can ask informed questions when I go to the dentist next time, which is really great. And yeah, and a lot of us do have fear around that. Actually, I don't know if it's a symptom of where I am in life right now, but I was never anxious about the dentist until
Hmm.
recently. It's been a very recent thing in the last maybe 2, 3 years for me that I've had the same dentist. Well, it's a different family member or member of the staff, but I've been going to the same
Yes.
dentist since I was 3,
Oh, wow.
which is
That's
pretty
amazing. They have all
amazing.
kinds of records for you then.
I know, and he's still practicing, and he's in his 80s, but now he's built this big dental clinic. So,
Mhm,
but yeah, so I've been going there. Yeah, so they must have my records for forever, and they
mhm,
can probably give me a really good history on all of that. But yeah, I was never nervous about it. I've known my dentist for such a long time, and but lately, yeah, it's been more of an anxiety thing, and I've had to practice like breathing. I'm bringing my music or something just because so I can get through the session. So that's kind of new for me to have that kind of anxiety, but I can only imagine that people have been having it for years. And that's not always easy to deal with. Do you have any tricks
absolutely.
for that for people who are nervous about going to the
Yeah,
dentist?
you mentioned some really good things. I would add a couple to them. One is, tell whoever you're working with, like, I'm a little anxious. I don't know why today, but I'm a
Oh
little,
yeah,
because
I
we do have
do.
a few
I
tricks.
do.
I always tell people, if you need anything or you need me to stop or whatever, just raise your left hand so that I
Mm.
can stop, because when we have our hands in there, I sure don't want to accidentally do anything. So if you just raise your left hand, then we can stop. But sometimes bringing a blanket with you, especially a lot of people are using weighted blankets. They find that really calming if
Mm.
they're anxious. Music is fantastic because there's a lot of sounds in the office that we're not used to, and we might not associate with like fun times, right? And maybe the time of day makes a difference for you. Maybe you're less anxious in the morning when you're fresh,
Mm.
and maybe you meditated before you came, or you know got your zen on before you came. So all those things are helpful, but just really have that conversation with whoever your hygienist or dentist is that day, because it is so common, but we really appreciate having that conversation so we can take all those extra steps to make it the best experience, because everybody wants their clients to have a good experience in the chair and come back, because we know how important it is that we see you regularly, so we can keep you in tip top shape and getting on to do all the things that you love.
Yeah, that's so good. And that's so helpful. And I have been telling them because it is such a concern of mine that they won't stop. So they said, no, no, anytime, just let us know you need to stop. We'll stop. And that just made me
Yeah.
feel so much better that I was like, okay, I can breathe. I can be okay. Yeah, it's just an interesting phenomenon anyways. And I know that anxiety is a common perimenopause symptom, menopause symptom. So if anybody out there is feeling anxious about the dentist, all of a sudden you are not alone. It is me too. But I love that Christine has some ideas for us that we can bring a blanket if we want to, or we can bring some music, or, there's things we can do to be more comfortable because it is such an important thing to do. So I also want to know because I mean, you are a dental hygienist, but now you are coaching women um, with
Mhm.
specific conditions. So you mentioned polycystic ovary disease and you mentioned metabolic disease.
Mhm.
Why these particular conditions and how are you blending oral systemic health with that? How is that working?
Right. Yeah. So this is close to my heart because I was diagnosed as a teenager with polycystic. And unfortunately, it's one of those diseases that it's not a one thing cures all of it. Everybody is an individual, everybody has different symptoms, and how to treat those symptoms can be different for everyone. And so I have found some things that have worked for me, not that the same things would work for everybody else, but I'm passionate to that group of people because the latest statistics are 1 in 10 women will be diagnosed with polycystic ovarian disease and or
Hmm.
metabolic syndrome. And so that's just crazy to me that it's gotten so high, because when I was diagnosed years ago, I didn't know anybody who had it. And so I just wanted to know as much as possible and learn all the things. And so one thing that's super, super common, not through just these disorders, but a lot of chronic disease, is inflammation. And it's kind of said that inflammation is the the beginning of all disease, so to speak, most all disease. And so that's something that I really focus on in my practice, is how do we reduce inflammation in the mouth, in the body, because we don't want any active infections. And so we need those screenings done in the mouth to know what we're dealing with there. Because if you have things going on in your gut, for example, you need to make sure that things aren't happening in your mouth as well, because they are so connected. And whatever you're trying to do in your gut, you're only going to get so far if you have some inflammation in the mouth. So it's just super, super important to really look at that inflammation and the things that cause inflammation, and the things that we can do to decrease inflammation is also important. And so when I'm doing my health coaching and I'm working with a client, we go through all sorts of things, including sleeping habits, your fitness, your nutrition, your history, personally and with your parents, and all that good stuff, and where you're currently at in a medical sense and in a dental sense. And then we come up with a plan together and we really work through this journey together. And we want to make small, sustainable changes, so that we can get reduced inflammation in our body and we can get healthy, and not need to rely on as many supplements and medications and all of that sort of stuff. Some are necessary and some work really well. And that's part of the personalized experience, is we work together and with other professionals to figure out what works for you and your body, so you can be the best you can and have energy and do all the things that you love.
That's so good. And it's so needed because, like you said, inflammation is the root basically of so many
Hmm.
of the issues we have, and if we can reduce the inflammation in our bodies. And I know with the coaching I do as well, it's a lot about that, because I think the less inflammation we have, the less menopause symptoms we tend to have as well. So I think it does go, it is such a root of so many things, that of pain in our bodies, of all kinds of things that are going wrong, is if we can look at the inflammation. And like you said, sleeping, fitness, nutrition, I would add stress to that too. And just all
Absolutely.
these things, right? And then just
Oh,
we're so much more vulnerable in midlife to stress because of the decrease of our female hormones. We're not protected as much anymore. So that's a big one I work on with my clients, because yeah, it becomes more of an issue, and it is a root of inflammation in our bodies and our mouths, which is included in that. So that's so good that you are there doing that. And I mean, do you have any clients currently that you're working with who have PCOS, who, or PCO, I guess you call it polycystic ovary disease? I know I've always called it PCOS. Is there a difference, or like syndrome disease, or it's just a different
it's
terminology?
interchangeable. Yeah, it depends what literature you're reading or who's saying it, but it's the same thing. Yeah, it is the
Okay.
same thing. And to your point, stress, absolutely. Could we be any more stressed than we are right now? And
No.
especially in midlife, some of us still have children that we're doing, and then we have parents who need help, and we have jobs, and we have significant others and friends, and it can be a little crunching, and you can kind of feel it coming from all those different areas. So
Yeah.
stress is huge
Yeah,
factor in our inflammation.
absolutely. Absolutely. Yeah, so have you worked with like clients through your coaching that have, you know, gotten some success in terms of like reducing their inflammation, and do the what specifically do you find has helped them?
Right. Yeah. So a lot of things is going and getting in touch with your body and how you're feeling. So I use a lot of scales. Like when we start out, like, how are you feeling on a scale of 0 to 10? Where are you at? Because although we have some tests like hormone tests or A1Cs or blood pressure that give us concrete numbers, we also have to be in touch with ourselves. And I think sometimes we have a disconnect there. So I really focus on how are you feeling with what we're doing. So maybe we've added some exercise, maybe some simple walking, maybe walking after meals, because that really helps us with that glucose spike after
Mm-hmm.
we eat, to not get that as high or at all. But how does that make you feel? And we've seen some really success in that women are feeling better just by making small changes. And it's not walking for 6 hours after supper, it's a 10-minute walk around the block. And it can really make a difference, just these small, small changes. And that's my goal. I want to help you feel the best that you can, and empowered and strong, and do the things you love.
That's so good. I'm all about that. I'm all about the small changes. It's the way I work with my clients too, is just to make the small things, because I think it's always surprising. We always think we have to do the big stuff, to
Mhm.
work out really hard. We got to transform our diet so we don't have any sugar or anything in it that's but it's the small changes that you're going to make. And just I like that you mentioned, how does that feel in your body, because a lot of times I think we count on the numbers that are outside of us, like we're
Mhm.
asking for other people to tell us, are we doing okay? But how often do we check in with ourselves to know, or feel like, am I doing okay? Am I not doing okay? What is going on with me? Where is there pain? Is there am I'm not having ease right now. What is that coming from? Just to having that sort of inquiry into ourselves is such a good practice, and so valuable, because we do put way too much weight in all these other externals that other people are going to tell us, that, that's just a part of the picture, but it's not the whole thing.
Absolutely. I agree with you 100%. Um, if we make sweeping changes, we often can't sustain them.
Mhm.
And then we're back to square one. So I think in all aspects, whatever your personal goals are, you're better off to make small steps to get to your goal rather than sweeping ones so that it's sustainable.
Yeah. Yeah, that's so important. Exactly. It's just to make these steps and so that they integrate kind of seamlessly into our lives without making too much disruption. And it just kind of happens without it being too difficult either. And I think people are always surprised that really, that wasn't so hard. That's not so bad. Having that extra glass of water or that 10-minute walk or, all
Yes.
of these little things that do make a big impact over time. It's surprising to people that they didn't have to restrict themselves and punish themselves into getting better health.
Yes, absolutely. Because nobody wants to be
No.
fighting with themselves every second of every day on what they can and can't do. That's no fun.
No, and I think as women, that's what we spend the first part of our lives doing. We
Hmm.
spend it being very hard on ourselves and very like, well, we've got to now be very regimented in how we do things so that we can, have the body that we want, so that we can be the person we're supposed to be. But it's not working at this point in life, and it just adds to your total stress to put that on yourself. So I think this is really key here. And it's definitely good for your inflammation and all of that too at the same time.
Absolutely. It all
Mm.
works together, right? It's all
Yeah.
connected. And you'll see the difference overall, but it doesn't have to be sweeping. It can be little things that are going to make a really big difference. And anytime you're able to focus on yourself and how you're really feeling is always a good thing, in my opinion.
Yeah. Yeah. And to learn to trust in yourself as well. It's part
Hmm.
of that process, right? That you do have
Absolutely.
a lot of the answers inside of you and we have to learn that we're actually this body of ours is a tool to tell us how we're doing. Are we and if we can tune into that, it will tell us the answers. So I do believe that if we inquire enough, we'll get there. So
Yes.
I know we're getting to the end of our conversation, which I love, and I love everything you've you've shared so far, but I do want to know, and I ask all my guests is for you, what's been the best part of getting older so far?
Yeah. For me, it's just being comfortable in who I am. I think the older we get, we just have a little more time to spend on the things that we love to do, our hobbies, going for a walk with a friend. It's the little things in life that we can really, really cherish and get rid of some of the noise. We're not as
Mm,
worried about what so and so is doing or it's like it doesn't matter. I can do my own thing and be my own person. And I feel again with this time that maybe we have a little more time to help others. And that's really where I focus. I really want to help others as well and
mm.
just be the best version of themselves and do all the wonderful things that they want to do. So I love getting older actually, which might not be a common um experience, but I really do feel that it's the place to be and just so nice to be able to be comfortable in your own skin and good with who you are.
That's really good. That's really good. It's good to get to the point where you can say that, where you love getting older, right? We,
Yeah.
we don't say that enough. We don't hear that enough. And I think it's important because, like you said, it's such a time of like coming to the place where you can take care of yourself now, where it is, you can honor yourself, you can do the things that are important to you finally. It just feels like it's a time of permission for ourselves that we haven't given ourselves that permission up until now, and we can now do the things that truly resonate. So I do love that and that idea. So I love getting older too because of that.
Yeah, and I wish we could say that from the beginning, right? Wouldn't that be nice
Yes.
if we were like 20 and be like, "Oh, I'm totally good with who I am." But unfortunately, in society right now, it doesn't end up being that way. And I always think, what's the alternative? Like, if we're not getting older, like, It's not a great alternative, so you might as well embrace it, right?
Yeah, exactly. And we don't want to stay stuck in a place where we don't feel like we're getting like where we're accepting ourselves. This is the
Yeah.
time to finally accept yourself. This is who you are. And you
Hmm.
can love yourself the way you are. And I don't know why we don't know this at 20. Most of us. I'm sure there are some pretty ahead of their time 20-year-olds out there. But
Yes.
I think most of us are like, yeah, this is midlife is a time to start accepting this is who I am and I actually like who
Mhm.
I am. So, yeah, getting people to declare that is so powerful.
Absolutely.
So, if the women in my audience want to
Mhm.
learn more about you, want to get in touch with you, how is the best way to do that?
Yeah, so I have a website that they can check out more about me. They're welcome to contact me as well. So my website is www.fusionhealthcoach.com, and my email is fusionhealthcoach@gmail.com.
Perfect.
Pardon me,
Good.
at Gmail. Yeah.
At Gmail.
So that is the easiest way, is just to email me or through my website. If somebody's interested and just wants to know more on a personal level, I do offer a free strategy session just so I can find out more about them and what they're looking for, and if we're a great fit to work together to help them get to their goals, because that's ultimately what my coaching is all about. It's about them and where they want to go, and can we get you where you want to go. And so they can reach out to either of those things. I'm on LinkedIn as well. And I would be happy to talk to anybody who is interested in finding out more or working together.
Okay, great. So, what I'm going to do is I'm going to include all your links in the show notes. So, anybody who's interested can go to the show notes of this episode, whatever platform you're listening to, and you can get in touch with Christine. So, and it's been such a joy having you here, Christine. I really appreciate what you brought to the podcast today. It was something new, refreshing. I didn't talk about this before, so I'm really, really glad that we connected.
Yes. Well, thank you so much for having me. I really appreciate it. I am so passionate about this, and I just want everybody to know about this connection and the difference that it can make in their personal health journey so they can live their best lives.
That's so good. Thank you so much.
Thank you.